How is it going to affect small business? Let's ask the chair of the Senate Committee on Small Business and Entrepreneurship, Louisiana Senator Mary Landrieu. Good to see you again, Senator. It's a pleasure to have you here.
Thank you. Good afternoon.
Tell us what you make of this bill that went through the Finance Committee yesterday. Is this going to help or hurt small businesses?
Well, we hope it's going to help, and that's been the focus of several of us, trying to drive down costs, not just for the taxpayer and to the government generally, but to small businesses and to individuals as well, because it's one of the reasons we entered into this fray to begin with, is that the cost of premiums is skyrocketing. It's very unpredictable, very difficult for large and small businesses to provide insurance to their workers and putting us at a competitive disadvantage.
What do you have to do to bring those costs down then, Senator?
Well, there are a couple of things, and the Baucus mark has captured some of them. For instance, medical records, more transparency in the system, aligning incentives with not giving a volume of care, but quality of care. Incentivizing doctors for good outcomes, not just for volumes of reports, and documentation. Those are examples of cost containment, and the bill is full of them. Maybe we can get some more. That's what I'm hoping, because the costs are really unsustainable over the long term.
Yeah, I believe the Baucus bill, like the others, has some penalties imposed on businesses that are otherwise required to insure their employees. So they have to pay some kind of a fee or a tax. I forget what the exemption is for how small your business can be and be freed from that requirement. Do you know it offhand, and do you think it is low enough of an exemption? Well,
we need to work in that area, but first of all, there's no business mandate, which was a big problem for small businesses in the initial version.
Oh, not even from the biggest employers, I see.
There's no mandate to require small businesses to provide insurance, which was their #1 objection. The next is to try to figure out a way to encourage employers that have insurance to keep it and not let anybody get a free ride. Now, we've put in the Baucus bill sort of an individual responsibility. It's going to be the responsibility of all individuals in the United States to try to provide themselves with health care. Now, the government's going to step in and subsidize the lowest income, some middle income families, and then give tax subsidies to others, including businesses.
Senator Landrieu, what do you say to the critics who say the reason that you keep seeing premiums go up is because state legislatures year after year impose more and more mandates? You got to cover this, you have to cover that, et cetera, et cetera. Said it yesterday, I'll say it again today. You'd never pass a law in a state that says you can only sell Cadillacs, but every state seems to pass a law that says you can only sell Cadillac health care, and so only people who can afford Cadillacs are able to buy the health care.
Well, that's one of the reasons that we've got to do this national reform, because you're correct. That's exactly what's happening. In addition to that, we've been cutting doctors, cutting hospitals, cutting providers, which only causes them to move out of the system. Less people are insured, and the prices go up for those that are insured.
What about being able to buy across state lines?
We are trying to do that, and the Baucus bill provides exchanges, interstate exchanges, regional exchanges. So for business, we want no business mandates, minimal penalties, if any, good tax subsidies to encourage them to provide quality insurance, and lots of choices in the marketplace for small businesses particularly.
Do the exchanges, and I'll let you can get one more in as well, do the exchanges take the place of the public option as it has been known? Is that the solution as opposed to government getting involved?
Yes, in my view, I'm not for a national public option, because what I am for is robust competition in a reformed marketplace that encourages and brings down costs because of competition and choice. I think that's a better approach.
I like that idea. Senator, you talk in your op-ed today about how important small businesses, they hire far more people than big businesses. Are you pleased? Do you think the Baucus bill goes far enough for small business? Do we need to do a few more things to stoke small business?
We probably need to do a few more things. I'm going to be holding a hearing on the Baucus mark and how it affects small businesses.
Okay, you got an example of an extra thing you want to do? Give us a possible proposal of an extra measure for small business.
Well, I want to make sure that the exemption is high enough. I think we've exempted businesses 50 employees or lower. We're still examining the mark ourselves.
We want to make
sure. Yeah, we'd like to raise it if we could. We want to make sure that there are ample tax deductions for the self-insured. Remember, there are 20 million self-employed individuals. We'd like to make sure that they have appropriate tax cuts like other businesses.
Thanks so much for being with us.
Thank you.